Welcome to Final BDS Made Easy. In this video, we are going to discuss the one marker questions from the subject of Conservative Dentistry and Endodontics. Question is critical pH. The critical pH for dental enamel demineralization is approximately 5.5 to 5.2. Below this pH, the hydroxyapatite crystals in enamel begin to dissolve, leading to the formation of carious lesions. This value is crucial in understanding the balance between the demineralization and remineralization processes in the oral environment. Question number 2 is parts of rubber dam. The parts of rubber dam include rubber dam sheet, rubber dam frame, rubber dam punch, rubber dam clamp, clamp forceps, rubber dam napkin, rubber dam stamp, rubber dam lubricant, modeling compound, and other retainers such as dental floss or tape or an elastic cord. Number 3 is autoclave. Autoclave is a device used for sterilizing dental instruments and materials using steam under pressure. The typical parameters are 121 degrees Celsius at 15 pound per square inch for 15 to 20 minutes or 134 degrees Celsius at 30 pounds per square inch for 3 to 10 minutes, effectively eliminating all forms of microbial life including spores. Question number 4 is root caries. This is the caries that is seen on exposed root surfaces following gingival recession. Since it is generally seen in elderly patients, it is also called senile caries. Root surface caries spreads more rapidly when compared to caries on other surfaces, and therefore it has to be treated soon after detection. Number 5 is abfraction. It is the loss of tooth surface at the cervical areas of teeth caused by tensile and compressive forces during tooth flexure. Question number 6 is resin modified glass ionomers. Resin modified glass ionomers are a hybrid dental restorative material that combines the properties of glass ionomers and composite resins. They provide improved aesthetics, increased strength, and better fluoride release compared to traditional glass ionomers. The powder has the usual ion-leachable fluoroaluminosilicate glass particles along with initiators for light curing and/or chemical curing, and liquid contains water and polyacrylic acid modified with pendant methacrylate groups and hema monomers. The resin component is between 15 to 25%. Number 7 is sectional matrices. Sectional matrices are dental devices used to create proper anatomical contacts and contours for class 2 composite restorations. These pre-contoured matrix bands are placed between teeth and held in position with a contact ring, allowing for better adaptation and a tighter interproximal contact. Early systems include compositite and bitine rings. Question 8 is self-etchant primer. Here the etchant and primer are in one bottle while the adhesive is in a separate bottle. For this system, first the etchant and primer are applied on the tooth surface, which is then followed by the application of the adhesive agent. Subsequently, the bonding agent is light cured. Example is Clearfill, SE Bond, and Xeno Dentsply. Question number 9 is mulling. It is a step done after trituration so as to make the mix homogeneous and cohesive. In hand mixing using a mortar and a pestle, mulling is done by collecting the amalgam in a dry piece of rubber dam or chamois skin and rubbing it vigorously between the thumb and forefinger for 2 to 5 seconds. While mixing in an amalgamator, mulling is done by continuing the trituration for an additional 2 to 3 seconds. This way, any remnants of the amalgam on the capsule walls are collected and the mix is delivered as a coherent and consistent mass. Question number 10 is pickling. This is the process of removing the surface tarnish or oxide layer. It is done by placing the casting in a test tube or porcelain beaker and pouring a warm solution of 50% sulfuric acid or 50% hydrochloric acid over it. After pickling, the acid is poured off and the casting is removed and washed. Number 11 is cavity varnish. A varnish is a natural gum such as copal, rosin, or a synthetic resin dissolved in an organic solvent like acetone, chloroform, or ether. When applied on the tooth surface, the organic solvent evaporates, leaving behind a protective film. Varnish is commonly used beneath amalgam restorations to seal the amalgam tooth interface until corrosion products form to reduce the marginal gap. The thickness of the varnish is 2 to 5 micrometers. Question number 12 is bevels. This refers to a plane of a cavity wall or floor which is directed away from the cavity preparation. Bevels are placed on the occlusal and gingival cavo-surface margins of the cavity preparation. According to their shape and extent of tissue involvement, bevels are of 6 types, that is partial, short, long, full, counter, and hollow ground. Number 13 is retention form. This is that shape or form of the tooth preparation that resists displacement or removal of the restoration from tipping or lifting forces. Question number 14 is calcium hydroxide. Calcium hydroxide is a dental material commonly used as a pulp capping agent and a liner. It promotes the formation of reparative dentine, has antimicrobial properties, and creates an alkaline environment that aids in the healing of the pulp tissue. Question number 15 is IRM. IRM or intermediate restorative material is a reinforced zinc oxide eugenol composition used for temporary restorations. It provides good sealing properties, has a sedative effect on the pulp, and can last for extended periods in the oral environment. Question number 16 is wedges. Wedges are devices that create rapid separation during tooth preparation and restoration. They help create space, stabilize the matrix band, and provide proper contour for composite restorations by preventing overhangs and ensuring tight contacts. 17 is endodontic biofilm. It refers to a complex community of microorganisms that adhere to the root canal system's walls and are embedded in a matrix of extracellular polymeric substances. These biofilms are resistant to antimicrobial agents and contribute to persistent infections in the root canal system. Number 18 is lateral condensation. The core of this technique is placing tapered gutta-percha cones in the canal and then compacting them against the canal walls under pressure by using a spreader. Question 19 is chelating agents. Chelating agents such as ethylene diamine, tetraacetic acid, and citric acid are used to remove the smear layer and facilitate canal cleaning by binding to and removing calcium ions from dentin. Question 20 is CBCT. CBCT is a specialized imaging technique used in endodontics to provide 3D images of teeth and surrounding structures. It aids in precise diagnosis of complex root canal anatomy, treatment planning, and assessing the extent of periapical lesions. Question 21 is Dentinal Map. The dentinal map refers to the distribution of dentine in relation to the pulp chamber and root canals. It guides the clinician in determining the thickness and structure of dentine for effective canal instrumentation and obturation. Question 22 is reversible pulpitis. It is a mild to moderate inflammatory condition of pulp caused by noxious stimuli in which the pulp is capable of returning to the normal state following the removal of stimuli. It is an indication of peripheral A delta fiber stimulation. Determination of reversibility is the clinical judgment which is influenced by history of patient and clinical evaluation. 23 is gauge Glidden drill. GG drill is a rotary instrument which has a flame-shaped cutting point mounted on long thin shaft attached to a latch-type shank. It is used to enlarge and shape the coronal portion of the root canal, particularly in wider or more accessible areas of the canal. It facilitates improved access and preparation during RCT. Question 24 is X articulation, also called eversion. It is defined as complete and total displacement of the tooth out of the socket. Common cause is a directed force sufficient to overcome the bond between the affected tooth and the PDL within the alveolar socket. That's it. Thank you for watching. If you appreciate this video, do hit the like button, share it with your friends, and please subscribe to my YouTube channel. Stay tuned for more such videos.